Let's give your brain a little GI booster today. Today's lesson covers the basics of the gastrointestinal system with a special focus on abdominal quadrants, common causes of abdominal pain, appendicitis, and the physical examination maneuvers you must know. I'm Dr. Famous Favour, and you're watching Prompt Review Academy. This is a high-yield topic for the AANP and ANCC board certification exams, and it is also essential for your everyday practice as a nurse practitioner. We are covering just a few key concepts today, but if you want a more comprehensive review, practice questions, predictor exams, and expert board preparation strategies, visit promptreview.net or call us at 909-6192-9288. Before we begin, please subscribe to Prompt Review Academy, turn on the notification bell, and share this video with another NP student or healthcare professional. Now, let's get started. The abdomen is divided into four major quadrants: right upper quadrant or RUQ, left upper quadrant or LUQ, right lower quadrant or RLQ, and the left lower quadrant or LLQ. For board exams, you need to connect each quadrant with the organs and conditions commonly found there. Let's test your knowledge. Pop quiz number 1. A patient presents with severe right lower quadrant pain. What diagnosis should immediately come to mind? Appendicitis. Exactly. Now, what about right upper quadrant pain, especially after eating a fatty meal? Think gallbladder disease, particularly cholecystitis. What about left lower quadrant pain in an older adult with fever and changes in bowel habits? Think diverticulitis. What about severe upper abdominal or left upper quadrant pain radiating to the back? Think pancreatitis, which often presents with severe upper abdominal or left upper quadrant pain radiating to the back. Here is your high-yield memory anchor. RUQ equals gallbladder. RLQ equals appendix, LLQ equals diverticulitis, LUQ or epigastric pain radiating to the back equals pancreatitis. Remember, these are classic associations, not the only possible causes of pain in each quadrant. Now let's focus on one of the most important causes of acute abdominal pain: appendicitis. Appendicitis is one of the most common causes of an acute surgical abdomen. The appendix becomes inflamed, usually after obstruction of its lumen. The obstruction may be caused by a fecalith, lymphoid tissue swelling, or another obstructive process. Here is the classic board presentation. The patient initially develops vague, poorly localized periumbilical pain. Then the pain migrates to the right lower quadrant. That migration is extremely high yield. The patient may also experience loss of appetite, nausea or vomiting, low-grade fever, right lower quadrant tenderness, guarding, and rebound tenderness. Here is your board pearl. Pain starts near the belly button and moves to the RLQ. Think appendicitis. One of the most important examination findings is tenderness at McBurney point. McBurney point is located between the umbilicus and the right anterior superior iliac spine. Tenderness in this area supports the diagnosis of appendicitis. For your exam, McBurney point equals right lower quadrant tenderness equals appendicitis. If you suspect appendicitis, the evaluation may include history and physical examination, CBC, pregnancy testing, when appropriate, urinalysis to evaluate alternative causes, and imaging when indicated. A CBC may show leukocytosis, but remember, a normal white blood cell count does not completely rule out appendicitis. Imaging depends on the patient. In many non-pregnant adults, CT of the abdomen and pelvis is highly accurate. In children and pregnant patients, ultrasound is often the preferred initial imaging study to reduce radiation exposure. If appendicitis is strongly suspected, the patient needs urgent emergency or surgical evaluation. As a primary care provider, you do not send a patient with suspected acute appendicitis home to wait and see. Now for one of the most testable parts of the lesson, appendicitis physical examination maneuvers. We will cover obturator sign, psoas sign, Rovsing sign, Markle sign, Blumberg sign, and McBurney point. Let's make them easy. The patient lies down. Flex the right hip and knee to approximately 90 degrees, then internally rotate the hip. If this causes right lower quadrant pain, the obturator sign is positive. Memory trick: obturator equals rotate the hip. Think, obturator equals rotator. This maneuver may suggest irritation from a pelvic appendix. The psoas sign can be tested by extending the patient's right hip or asking the patient to flex the right hip against resistance. If this produces abdominal or right lower quadrant pain, the psoas sign is positive. Memory trick: psoas equals stretch the hip. A positive psoas sign may suggest irritation from a retrocecal appendix. For Rovsing sign, palpation of the left lower quadrant causes pain in the right lower quadrant. Yes, you press on the left but the patient hurts on the right. That is the clue. Memory trick: press left, pain right. Positive Rovsing sign? Think appendicitis. Now let's talk about the Markle sign, also known as the heel drop or heel jar test. The patient rises onto the toes and suddenly drops onto the heels. If this jarring movement causes abdominal or right lower quadrant pain, the test is positive. Blumberg sign refers to rebound tenderness. The examiner applies pressure to the abdomen and then releases it. Pain that worsens with release suggests peritoneal irritation. Let's test your knowledge. Question 1. Internal rotation of the flexed right hip causes right lower quadrant pain. Which sign is positive? Answer: obturator sign. Question 2. Pressing on the left lower quadrant produces pain in the right lower quadrant. Which sign? Answer: Rovsing sign. Question 3. Extending the right hip produces abdominal pain. Which sign? Answer: psoas sign. Question 4. The patient drops suddenly onto the heels and develops abdominal pain. Which sign? Answer: Markle sign. Excellent. A 22-year-old patient presents with nausea, loss of appetite, and abdominal pain that began around the umbilicus and later migrated to the right lower quadrant. Examination reveals tenderness at McBurney point. Internal rotation of the flexed right hip reproduces the pain. Which physical examination finding is present? A. Murphy sign. B. Rovsing sign. C. Obturator sign. D. psoas sign. Pause the video and choose your answer. The correct answer is C. Obturator sign. Internal rotation of the flexed hip causing right lower quadrant pain is a positive obturator sign. If you selected C, excellent work. Before we leave, remember these high yield concepts: RUQ for gallbladder, RLQ for appendicitis, LLQ for diverticulitis, upper abdominal pain radiating to the back for pancreatitis. For appendicitis, periumbilical pain migrates to the RLQ. McBurney point equals RLQ tenderness. Obturator equals rotate. Psoas equals extend. Rovsing equals press left, pain right. Markle equals heel drop. Blumberg equals rebound tenderness. If this video helped you, please subscribe to Prompt Review Academy, turn on the notification bell, and share this video with a fellow NP student, nursing student, or healthcare professional. Want more practice questions and courses? Visit Prompt Review Academy at promptreview.net or call 909-619-2928. Learn smart, study with purpose, pass with confidence. Thank you for watching, and I'll see you in the next high yield review.